Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, May the 26th, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto City Councillor and Chair of the Board of Health, Joe Cressy. Mayor Tory?
Well, Brad, thank you and good afternoon. Our Team Toronto effort has now administered more than 2 million COVID-19 vaccine doses in our city. We are the first local health region in all of Canada to administer more than 2 million doses. And this is great progress. And it comes just a day after we confirmed more than 65% of eligible Toronto adults have now been vaccinated, and we achieved that a week ahead of the provincial target. Thank you to everyone involved in our vaccination efforts, city staff, public health, hospitals, healthcare partners, community health centres, community organizations, pharmacists, doctors' offices. There's a lot of people that make up the Team Toronto that is putting these achievements on the board. Their tireless work has gotten us to this point, and we know that they're out there even today getting more and more people vaccinated. And thank you to everyone who has already stepped up to get their vaccine. It's a two-way process here. We need people to give the vaccinations and organize all that goes with that, and we need people to get them. Today, we will be talking about VaxTO, our plan to further ramp up vaccine outreach efforts and make sure that we reach absolutely everyone in our city to encourage them to get vaccinated. Before I talk a little bit about that, and it'll be expanded upon by Councillor Joe Cressy, the Chair of the Board of Health, who has had much to do with this VaxTO program, I want to just acknowledge this is Toronto Paramedic Services Week. Paramedic Services Week is a time to honour the challenging work and the responsibilities that paramedics have day in and day out in homes and in hospitals and right across the city. And of course, the paramedics that are in our service in the City of Toronto have performed extraordinary service during the course of the pandemic on the front lines every single day. Their commitment has helped us to navigate through these unprecedented times, and as we move forward, they are going to continue to be vital to our efforts in reaching all corners of the city. They've helped us in the clinics, for example. They've helped us with reaching people who are homebound. They've done a lot of things that have helped us with our overall efforts, and I want to say thank you to the paramedics for going above and beyond during this difficult time, but this is what they do all the time. And I encourage residents of the city to take some time this week to say thank you to a paramedic if you happen to come across one. As I mentioned, today the city is launching VaxTO, which is a new campaign to connect residents with COVID-19 vaccination appointments and information so that we can push our vaccination rates up above 70% and frankly as high as possible. You know, we've now done 65%. That's a commendable level to reach in a relatively short period of time, but that still leaves 35% who have not yet been vaccinated. And to push the numbers higher will be crucial in our progressing through the province's roadmap to reopening, which will rely quite heavily on vaccination levels, though not exclusively on that. I cannot stress enough, if you, like me, want to get on with reopening as soon as possible, then one of the things you have to do is to get vaccinated, or if you know someone in your close circle who hasn't been, to encourage them to do so. The vaccines will be instrumental to bringing this pandemic to an end. They will bring back normal life. They will help keep you from being infected. They will help keep you from infecting or getting infected your friends and your families and your co-workers. That's why we've been working so hard with community organizations across the city to reach out to people and encourage them to get vaccinated. It's why we launched the Vaccine Engagement Strategy, originally the Team Toronto Sprint Strategy and the Let's Get Toronto Vaccinated advertising campaign. We're building on all of that success today with VaxTO, which will further ramp up our outreach efforts. VaxTO works to proactively ensure that every resident can access their first and second doses of the COVID-19 vaccine by providing them with accurate and timely information about when and how they can do so. The campaign will be done in 3 phases. The first, which is now underway, encourages all Torontonians, if they haven't already, to book a first dose. The second phase, beginning in mid-June, will target neighbourhoods and communities with low first-dose vaccination rates. And the third phase, beginning in July, will continue to target Torontonians who have yet to receive a first dose and support the city's citywide second dose efforts. We won't be doing this on our own. This campaign will enable community and agency partners and city councillors to mobilize their own networks through direct contact tools in the local neighbourhoods and to get information out to community members and to constituents in a timely manner. Examples of tactics that will be deployed through this campaign on a citywide and local basis include texts, emails, voice broadcasts, telephone town halls, and targeted multilingual social media advertising. Last weekend, we kicked off the VaxTO campaign with the deployment of a telephone voice broadcast to 150,000 homes in 18 hotspot neighborhoods, which helped hundreds of people who answered the call to go on and book their vaccine appointment directly. There was no calling anywhere else. They got transferred directly through to book their appointments, and hundreds of people did so. Our next major event will be the first citywide telephone town hall on Wednesday, June 2nd at 6 o'clock in the evening. The town hall will provide Torontonians with an opportunity to ask questions directly to Dr. de Villa, Chief Pegg, and to myself. And today, as part of this campaign, I'm proud to launch the city's COVID-19 immunization text line. For anyone looking for information right now and eager to learn more, you can text vaccine to either 1-833-750-0888 or 833-750-0888 and get connected to book a shot, to sign up for a town hall, to get answers to a number of frequently asked questions on vaccines. Again, trying to make as much information as possible, as easily as possible to people using technology and other means. The features of this text line will be expanded over the coming weeks, but it's a good direct start that will help with all of our outreach efforts. Again, the number to call, 1-833-750-0888 to get to the city's vaccine text line. This is one more way in which the city can demonstrate that it is doing everything it can to help people get vaccinated and to make sure that we achieve that level of immunity that is going to help us to get back to a normal life. As the GCHA mayors and chairs noted yesterday when we met, we know that there is tremendous interest from many people in getting their second doses, and we are committed to working with the province to ensure people know where and when to get their next shot, recognizing that in some situations, including in all 9 city-run clinics, people have confirmed second dose appointments. Those were made at the time the first one was made, while people vaccinated at other locations may not yet have a confirmed second dose appointment. We want to make sure that every resident who had their first dose of COVID-19 vaccine is able to get their second dose to maximize their protection and the protection of the community. And so I want to echo the request made by the mayors and chairs of the 11 biggest municipalities in this region when they said that they would urge the province to confirm some of these second dose arrangements, particularly as they affect seniors, many of whom are very anxious as a result of the present uncertainty. A concise and clearly communicated strategy from the province will help all of us to get those second doses rolled out as quickly as possible while continuing to administer first doses to those who haven't yet received one. Before I finish, I want to raise everyone's attention to another very serious issue that is facing our city and that doesn't get anywhere near enough attention. I do believe it is something that we don't talk about enough, but it requires intensive attention because it too is a public health crisis. Overdose deaths in our city for some time now have been at a point where we should all be deeply concerned about the lives being lost, the amount of pain it is causing, and about the fact that the entire opioid overdose issue has steadily worsening trend lines, including those trend lines that have to do with increasing loss of life. Just last week, Toronto Public Health reported a record high number of opioid overdoses in 2020 in the City of Toronto. A total of 521 people lost their lives in this city to overdoses in 2020. That represents a 78% increase from 2019. The numbers confirm that this crisis has been made worse by the COVID-19 emergency. Clear evidence of a crisis. 521 people dead in one city in 1 year, many, if not most of those deaths, preventable. 521 people in our city lost their lives on something that was preventable and something we should all be focusing more attention on. My condolences to anyone who has lost a loved one to this opioid crisis. Just in my own case, I have relationships with 2 families that lost someone during this huge bulge of deaths that took place in 2020. I want you to know, all the members of those families and everyone else in the City of Toronto, that the families in particular have the support of the Mayor, and that I will continue to do everything possible, working with the Board of Health and with my colleagues and with anyone else who wants to take a keen interest in this, to make sure that the attention and the resources and the help that are needed are made available, because it is just not acceptable to have that loss of life, especially that preventable loss of life in many, if not all, of these cases. The report further demonstrates the work that we need to do to address this health crisis, and make no mistake, it is a health and a healthcare issue. There is no moral issue here. This is not a moral issue. It is about people who have a health problem with dependency and who need the same support that we would give to anyone else with a health problem. We are not yet seeing the supports and programs, provincially, especially from the provincial healthcare system, consistent with a crisis and a loss of life on the scale described in this report. 521 Torontonians dead in 1 year, and hundreds more in the year before that, in 2019. Same among those were likely told at some point before we lost them that there wasn't a treatment program available for them. Many people would have been told that. We should ask ourselves what kind of a debate we would quite properly be having if people who came down with a heart condition were told that there wasn't a program available to treat them. I want to thank the federal government for coming forward with funding towards our safer supply clinics. They are helping to save lives. As a city government, we continue to move forward under the leadership of Councillor Cressy and the Board of Health and Dr. de Villa as our Chief Medical Officer on other harm reduction work that is being led by Toronto Public Health, all of which is also helping to save lives. But we know there is much more that needs to be done to save more lives. That's obvious when we lost 521 people last year. I am determined to continue to work with the other governments to help people with substance abuse issues, to expand treatment programs, to change policies where needed, all in an effort to save lives. Much of this should properly be done by our healthcare system, and I look forward to the province showing increased initiative in this regard. We all have a part to play in this, and I will be trying to do my very best to make sure the city does everything it can to help people, but we cannot do it alone, and we have to do more. Now I would ask Chief Pegg to provide his report for today.
Thank you, Mayor Tory, and good afternoon. Before I begin my formal remarks this afternoon, I would also like to acknowledge that this is Paramedic Services Week. Each and every day, our Toronto paramedics are on the very front lines of emergency health care, community safety, and community well-being. The challenges of delivering emergency pre-hospital care in a city as large and busy as Toronto are very significant. But never before have we seen the dedication, compassion, expertise, and commitment of our paramedics to the extent we have during the response to COVID-19. Chief McEachern and the entire Toronto Paramedic Services team have been unwavering leaders, both in responding to COVID-19 and in administering COVID-19 vaccine, and have given us all so much to be thankful for. I would like to extend my sincere thanks to Chief McEachern and each of my Toronto paramedic colleagues who have given more of themselves than anyone ever thought possible. We are blessed to work alongside each of you each and every day. Over the course of the Victoria Day long weekend, more than 125,000 doses of COVID-19 vaccine were administered in our city. Everyone 12 years of age or older is now eligible to be vaccinated. As always, appointments in city-operated vaccine clinics can be booked via the provincial booking system by accessing toronto.ca/COVID-19 and clicking on the blue Book a Vaccine button on the top of the page, or by calling the provincial call centre at 1-833-943-3900. I want to remind everyone who has booked an upcoming appointment in a city-operated clinic that should you wish to take advantage of an earlier available appointment, you can do that by accessing the reschedule link that is included in your appointment confirmation email that you received when you made your original appointment booking. You can also reschedule your appointment by calling the provincial call centre again at 1-833-943-3900. I'm also very pleased to advise that we are opening an additional 1,080 appointments in our Metro Toronto Convention Centre clinic for tomorrow, May 27th. These additional appointments are now live in the provincial booking system and through the provincial call centre. This is an excellent opportunity for anyone who has not yet received their first dose of vaccine to do so tomorrow. While our city-operated clinics are nearly fully booked over the next few weeks, as of 1:30 this afternoon, there are approximately 96,304 first dose appointments still available in city-operated clinics between today and July 4. I encourage everyone who is 12 years of age and older to book your appointment to get vaccinated against COVID-19 as soon as you are able. Please go to vaccineto.ca for vaccine opportunities that may exist in Team Toronto partner clinics as well. And for those active on social media, I encourage you to follow Vaccine Hunters Canada on Twitter for additional information on opportunities to receive COVID-19 vaccine in Toronto. Thank you for all you do to help stop the spread of COVID-19 in our city, and please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. I will now invite Dr. de Villa to bring her report.
Thank you, Chief, and good afternoon. And if I might, I would also like to take the opportunity to echo the Mayor and Chief Pegg in offering greetings and well wishes to my paramedics colleagues, and especially to Chief McEachen on the occasion of Paramedic Services Week. Thank you for all that you do, and a special thanks and really, really sincere gratitude for all that you have done and all the collaboration and partnership that you have shown over the course of the entire COVID-19 pandemic. Today, I am reporting 353 new cases of COVID-19. 942 people are in hospital and 255 people are in the ICU. I'm saddened to report 7 deaths today. Overall, the measures of illness are in decline, which means our situation is improving. Vaccination is vital to sustaining the downward trends in these figures. There are 2 things, though, that are important to touch on today, both relating to vaccines and vaccinations. The first is to restate that if you are offered a Moderna vaccine, you can accept it with confidence. It provides a high level of protection against COVID-19. Every vaccine available to Canadians undergoes careful evaluation and review and is monitored constantly after approval for use. Moderna and Pfizer are very similar vaccines, and based on clinical studies, after completing the vaccination series, Health Canada describes them both as highly effective in preventing COVID-19. We know the vast majority of Torontonians support vaccination. If that's not you, let's get to the bottom of why. Because we absolutely need as many people as possible to join the ranks of the vaccinated. In that respect, I want to flag that currently around 28% of people aged 80 and over still have not had a first dose of vaccine. Yet those above 80 years of age are the most vulnerable to the threat of COVID. We know that many older adults prefer to go to their own doctor for care. At this point, access to vaccines through doctors' offices is limited for a number of logistical reasons, which may help to explain some of the gap. So please, do what you can to encourage and assist the elders in your life to get a vaccine through the means available now. We've all come so far in the past 14 months, but we should be especially protective and supportive of the eldest people in our lives. I also want to restate my challenge to anyone who has received at least 1 dose of vaccine. Share your experience with people you know. Encourage them to get vaccinated if they haven't been. I'm thrilled to see that almost 68% of people aged 20 to 24 have already had a first dose. And almost 48% of 16 to 19-year-olds have had a first dose too. That's a great achievement for an age group that became eligible so recently. But we need everybody to get the job done. It may be tempting, knowing so many people around you are vaccinated, to worry less about booking your own appointment. But the doctor in me has to remind you, no one has maximum protection until they're fully vaccinated. COVID-19 continues to circulate in Toronto, and if you're not fully vaccinated, that puts you at risk. So we have progress to be happy about, but a gap still to close. Like all things during COVID, so much of our future depends on the choices we make as individuals in the next few weeks. We're doing our part to keep you informed, to urge you to decide, and to provide you with vaccines at clinics. But we're just as happy if the deciding factor for some people is the encouragement from someone they know and someone they trust. Whatever it takes, please decide in favor of vaccination, protection, and peace of mind. With that, I'll now turn it over to Councillor Cressy to deliver his remarks.
Well, thank you, Mayor Tory, Dr. de Villa, and Chief Pegg. Today I'd like to tell you a little bit more about VaxTO, our new City of Toronto campaign to help achieve herd immunity. Now, since day one, we've built a Team Toronto vaccination campaign to reach every resident, in every language, in every corner of our city. Break down every barrier, build every bridge. That's been our Team Toronto model, and thus far, it's working. Our 155 community agencies are on the ground going door to door to help get people to pop-up clinics. Neighborhood ambassadors are building trust in their neighborhoods. Our Black scientists and our accessibility task forces are hosting clinics and town halls to overcome barriers. And our vaccine equity transportation plan is actively providing thousands of rides to seniors to vaccination clinics. You know, I talk a lot about how our Team Toronto vaccine campaign is driven by grassroots organizing. This is the work that's happening in neighborhoods and seniors buildings. It's happening in community centers and shelters, in churches and synagogues and mosques and temples. You know, this work may be happening below the surface, but it's having a huge impact on the ground. And as we enter a new phase in our vaccination campaign, it's time right now to scale up our efforts to reach every single Torontonian who's yet to book a shot. That's where our new VaxTO campaign comes in. In political campaigns, we run get out the vote operations every election, using a range of direct contact tools. In politics, we identified our confirmed voters, our likely voters, our undecided voters, and then we work to build trust, to earn their support, and to get them to the polls. In this new phase of the vaccination campaign, our VaxTO approach is no different. We've built new direct contact infrastructure, as the Mayor outlined, from text-based messaging to voicemail broadcasts, to help people get the information and the support they need to get vaccinated. Our initial goal here is clear: identify Torontonians that have yet to receive their first dose and answer their questions and help get them registered. And as we proceed into second doses, use every tool, absolutely every tool available, to ensure that people get that critical second shot. In this case, to carry on the election analogy, we want you to vote 2 times. You know, when we take a step back, Torontonians right now have really stepped up in this vaccination campaign. More than 2 million doses have been administered in our city. More than 65% of adults have received their first dose. This truly is tremendous progress, but we're not done yet. Success, true success, requires us to seek herd immunity. It's a big target, there's no doubt about it. But this is the campaign of all of our lifetimes, and in Toronto, we can do this. With that, I'll turn the floor over to Brad Ross as we open it up for questions.
Thank you, Councillor Cressy. We'll now go to questions. Just a reminder to please unmute yourself so we can hear your question, and we'll go first to Brian Passafume from the Toronto Sun. Brian, go ahead, please.
Good afternoon, everybody. Hope everybody had a great long weekend. First question, I guess, is for the mayor regarding the streetcar deal that was announced earlier today at the special council meeting. As you know, this deal comes almost exactly 2 years after the city settled its lawsuit against Bombardier over the city's first delivery of streetcars. I believe you in 2016 in an open letter accused Bombardier of a complete failure to perform. Do you have any reservations about this new order, and what's changed between now and then?
I think what's changed is what should happen in any company where they had that kind of difficulty, both with the manufacture and the delivery of the streetcars, which is that they got their act together. They knew that in our case we had an option under the original contract, which is the one we're now exercising, to buy more streetcars, and that if they didn't pick up their socks and get onto a delivery schedule that was acceptable and have streetcars that were, you know, well put together, as they largely were, it was really a delivery schedule problem, that we wouldn't buy the other ones that we had an option to buy. And they really got their act together in the later years after 2016, where they were delivering the last ones under the initial phase of that contract on exactly the schedule they said they would, and the streetcars were performing well. And so it made sense for us in those circumstances where they had cleaned up their act, as it were, for us to have the confidence. And I can assure you that the contract is very carefully drafted on the exercise of the option for the 60 new streetcars to make sure they meet a very high standard when it comes to the quality of the product and the delivery schedule of the product that they will supply to the people of the City of Toronto.
Okay, great, thanks. Second question, I just wanted to clarify something that you said in your opening remarks today. When I got my Pfizer shot last month, I was given an appointment for my second dose. I think it was in sometime in July or August. My wife usually keeps track of that kind of stuff. Will the possibility exist, if supplies allow us to get our second shot at an earlier date?
So, Brian, I think this is a question that is very much on the minds of our provincial counterparts, as they are the ones that have oversight on supply issues and second dosing. So I believe that that is something that they're actively discussing, and hopefully we'll hear from them soon about what their plan is. At this stage, as I understand it, the focus is on making sure that every dose that is available right now is being used, and we're certainly trying to work with the doses that we have to make sure that we're getting first doses out as quickly as possible to offer that protection to as significant a proportion of our population as we can. And in the meantime, we'll wait for our provincial counterparts on second dosing and what their approach shall be.
Thank you, Doctor. We'll go next to Dave Woodard from Global News Radio AM 640. Dave, go ahead.
Thank you. Good afternoon. On Tuesday, the province's Chief Medical Officer of Health said schools should reopen before going into the first stage of reopening, and even as early as May 31st. Dr. de Villa, what are your thoughts on schools reopening here in Toronto even before the end of the school year?
So, Dave, I will say this, that throughout the course of the entire pandemic, I and the team at Toronto Public Health have been patently clear that we are strongly in support of in-person learning insofar as it can be provided in a safe environment for students and for staff. And I would say further this, we also have been quite clear throughout the course of the entire pandemic that what supports the safest operating school environment is reduced COVID-19 transmission within our community. So I think that for all of us who would like to see the benefits of in-person learning for our children, the best thing we can do is to continue to practice the measures for self-protection, to help bring down COVID-19 transmission in our city, and of course to get vaccinated as part of our efforts to reduce transmission of COVID-19.
So if what I'm hearing is correct, you're not necessarily in favor of reopening if transmission levels continue above a certain level.
I'm in favor of schools reopening under circumstances that allow them to open safely. I think first and foremost, the health and safety of our students, our kids, and all the staff that are necessary to support the safe operations of schools is fundamentally what is most important. And I would say that we have been very clear over the course of the pandemic that when community levels of transmission of COVID-19 are high, by definition, it is a less safe environment for our children, as our schools are simply a reflection of what's happening in our community.
Thank you. We'll go next to Matt Bingley from Global News. Matt?
Hi, good afternoon. Chief Pegg, I'm just wondering, you talked about the 1,000 or so appointments that were added tomorrow. I'm just wondering, when it comes to the scalability of the 9 city vaccination clinics, where would you put them right now when it comes to an operations standpoint? And with the supply of vaccine from the province, if it were increased, how much would you be able to expand them to allow for first or even second doses right now?
Sure. Good afternoon, Matt. So at present, we're operating our clinics, rough numbers, about 2/3 of what our maximum capacity is. So we're operating just over the 60,000 dose threshold for a week, and we know from experience we can, without any difficulty, administer more than 90,000 doses. We've actually been as high as 98,000 doses on a weekly basis. So in the event that the province can make additional vaccine available to us, we can almost immediately. Literally, the time differential would simply be the amount of time required for the provincial booking system to be updated. We could pivot into enhanced capacity in a very, very short order.
Thank you for that. And Mayor Tory, when you're talking about looking for more clarity from the province on second dosages, what exactly is it that you would like to hear from them? Is it a timeline? Is it just for your planning purposes?
Just hang on and I'll deal with that first. I think the thing that most of us are looking for is a clear set of guidelines as to how second doses will be handled, a consistent set of approaches, because we found in all of the experience we've had with a lot of these different things, testing and vaccinations and so on, that when you have the kind of heavily populated market, say of Southern Ontario in particular, if there's multiple sets of rules, people get very confused. It's confusing enough as it is. And so I think we need to have some clarity with respect to when people should expect to get their second doses, in some cases how they will go about that, because there's confusion right now where people thought they could phone the same pharmacy they got their first dose at, which is a logical thing for them to think, and then when they phone they find out that's not the case. And so I think there's just a need for a clarification on when you should expect to get it, whether it's consistent with the original timetable or not, where you should expect to get it, and how you should go about doing that. And hopefully these rules can be consistent rules that are consistent, at least in this media market, which is a big region of 6 or 7 million people. I think that would be a great start.
All right, thank you. We'll go next to Holly Mackenzie-Suter from the Canadian Press. Holly, go ahead, please.
Hi, question for Dr. de Villa following up on schools. Your answer wasn't really clear to me, but I wanted to ask again, do you think Toronto can reopen schools next week if the province comes out with that decision?
So, Holly, what I would say is this. We'll certainly wait for the province to make their decision, and we will have to, ensure that we're looking at the numbers here in Toronto. My responsibility is to the people of Toronto, where we continue to have COVID-19 circulating at relatively high levels, even compared to that which we've seen over the course of the pandemic. Things are definitely improving. Certainly very interested in seeing kids get that benefit from in-person learning. You've heard me speak about that on many, many occasions over the course of the pandemic. And, I would be not doing my duty if I didn't make sure that we were doing the very best we could to ensure, that the circumstances are right, and that we can create an environment where everybody can be successful, students, staff, all of us as families, because these are our most precious resources, our children.
Okay, thanks. So would you say, if that decision were to come out tomorrow or by the end of this week, how the numbers are looking right now, do you think schools would be ready to reopen?
Well, I certainly have a lot of hope, Holly, and I think one has to maintain a certain amount of cautious optimism. So certainly keeping my fingers crossed, and I would just ask the good people of Toronto to do the very best they can. As I said, what we can all do together is to do our very best to reduce transmission of COVID-19. So that means vigilant practice of the measures for self-protection, really limiting interaction to the greatest extent possible, because that's where COVID-19 transmission happens. And of course, if you haven't already gotten your vaccine, please do so. Together, this is what we can do to help support the likelihood of children returning to in-person learning and getting all the benefits that derive from that.
Thank you. We'll go next to Derek Dionarain from the CBC. Derek?
Thanks, Brad. This first question is for Dr. de Villa. Some people are saying that this, as far as schools go in the reopening, that the decision shouldn't even really be the premiers or the cabinets or the education ministers, but rather instead it should be up to local medical officers of health. Whose decision do you think this should be to reopen schools?
Well, I think that local medical officers of health have, certain, I guess there's advice that we can provide and a valuable perspective that we can provide. But our purview is on public health, which is certainly an important aspect, but it's not the only one. So I do think it's important that the province engages in this decision. It is a matter of education. Fundamentally, schools are about education. No question that there are health benefits associated with that, but I don't pretend to know all the circumstances and all the needs and all the considerations when it comes to operating schools. What I do provide and what the team at Toronto Public Health provides is advice and important perspectives that relate to public health in particular and COVID, given that we are still in the midst of the COVID-19 pandemic.
Thanks. And my second question is for Mayor Tory. So the authors of a report on the opioid-related deaths in Ontario last year say that there were 31 deaths in shelter hotels in Toronto in 2020, that were obviously set up to help people experiencing homelessness. What is the city going to do about this? Will you be setting up harm reduction services in these shelter hotels?
Well, in fact, that's exactly what we have done. And I don't know if Ms. Bedard is on the line today, but she is on the line? Okay, well, I'll just say to you, that is exactly what we have done, is to, where we see evidence of that support being needed, we have moved in some of the temporary shelter hotels to put support services in place, harm reduction services in place. It is something that we have taken very seriously in these extraordinary arrangements we've had to make to care for people in the face of the pandemic. So maybe on that note, I'll ask Ms. Bedard if she would like to comment.
Marianne Bedard, are you on the line there?
Thanks, Brad. Yes, I'm here. And the mayor is right. We have taken steps during the pandemic to make sure that we're addressing the needs of people who are staying in our shelter hotels. We are aware that this has been a significant issue within the community and also within the homeless community. So when we established the hotel programs, we also made sure that that included a harm reduction approach. So all of the staff working at those locations have training on how to use naloxone. All of the programs have harm reduction supplies, sharps containers, and also in many of our programs, we have enhanced harm reduction services, including peer witnessing and supervised consumption. But I think it's really important to note that all of our shelters are expected to offer services based on a harm reduction approach. And that is something that the city has been committed to for a number of years.
Thank you very much, Marianne. Our final question is to Dave Ryder from the Toronto Star. Go ahead, Dave.
Hi there. At the risk of being a broken record, I'm going to ask Dr. de Villa about schools again, because at the end of these news conferences, we reporters all have to kind of parse the comments. And so far I've heard when asked that virus levels remain relatively high, which makes it sound like maybe Toronto schools are not ready to reopen before the end of June. But I also heard cautious optimism, and I'm just not sure how to interpret that. So I'm just going to ask as clearly as possible, have you provided advice to the provincial government about whether Toronto schools can reopen before the end of the school year? And do you think, based on the indicators right now, is that an actual possibility?
You know, Dave, I will say this. We've had regular conversations with our provincial counterparts, and we've had regular conversations with our local public health counterparts all around the province. We have noted that we continue to have relatively high rates of disease here, but we've also been very clear that we are interested in ensuring that our children have that opportunity as early as possible to get the benefits of in-person learning. You know, I'd like to actually be able to see as what the province makes their decision on and what they decide to move forward with. And once we know what they're dealing with, what they're proposing, then we can look at our specific data and understand what the circumstances are, put the necessary safeties in place, because that's really what we want to do is, yes, see our children get the benefits of in-person learning, but in an environment that we know is safe. So I am continuing to want to drive down levels of disease. I think that's perfectly reasonable as a local medical officer of health. And it's in fact what best ensures the safety of students and staff in the school environment. The more we can drive down the level of COVID-19 transmission through a combination of good self-protection measures and uptake of vaccine, the safer it is for our children, the safer it is for our staff in schools, and frankly, the safer it is for all of us as a community.
Thank you. And second question is about VaxTO. And I'm just wondering from whoever wants to answer, what is if you think, the single biggest barrier that the city has to getting a really high percentage rate of people first and second dose? Is it the people who are spreading misinformation on social media and marching in the streets in Toronto? Because obviously that can be persuasive. Or is it something else? And obviously, what can be done to overcome that biggest barrier? Thanks.
So Dave, perhaps I'll take a crack at answering your question, and we'll see if any of my colleagues wishes to add anything further. I don't know that there is a single biggest factor involved, and in fact, it may be quite different from one group to the next. As I mentioned in my remarks, for those who are over a certain age, the older members of our community, one of the factors is that they prefer to get their care through their own healthcare provider or their family doctor. And unfortunately, given a number of different logistical issues, it's just not that readily available, COVID-19 vaccine within most physician practices at this point in time. So sometimes it's a question of access and degree of comfort through the current channels by which vaccine is accessed. For other groups, it may be around information or an information gap that needs to be filled. And that's why I've asked those of you who've already received your vaccine to talk about your experience with those you know, with others in your network or circle of friends and family that you know haven't yet received vaccine, and tell them about your experience and tell them a little bit about why you got vaccinated. I think the more we are able to reach out to different segments of our society, different corners of the city, and let them know that vaccine is safe and it's accessible and, you know, will help you get there, the sooner we're able to get the greatest proportion of our community vaccinated, the sooner we'll be able to put this pandemic behind us and return to life a little bit more like we knew it before there was such a thing as COVID-19. I see the mayor may have something he wished.
I'd just like to add to this, you know, it's very important. This is a big undertaking. It has happened very quickly, relatively speaking. If you think about the fact that it was 15 months ago or 16 that COVID-19 was kind of unknown. The vaccines came on the scene in the fall. There's been a lot of opinions that have been expressed through the media and otherwise about the vaccines that people have to absorb. And so I think a lot of it has got to be a reasonable period of time for some people to accustom themselves to this, as opposed to those who, like me, I'll just go automatically if Dr. de Villa or my own doctor says it's okay. There are people who, you know, take more time than that when it comes to their personal medical situation. I think that when you ask the question of whether the protests have had any impact, fully respect the right of people to protest in our country, but I think that the kind of tactics that have been used, which have included things like abusing, verbally abusing family members who are bringing their kids to be vaccinated and so on, is just, you know, well less than responsible, and I think that's had no impact whatsoever because people see that for what it is, and I don't think it's had any impact. I don't think that's the issue. The issue is going to be addressed by VaxTO. Trusted people, being in touch with people, going through some of the questions they may have because they haven't had a lot of time to absorb all of this, and I think a lot of them will get convinced to get vaccinated. It just takes more time with some people.
Councillor Cressy?
Yeah, and Dave, if I could just expand a bit, I think the experience so far has really shown that Torontonians are stepping up to get vaccinated. In fact, as Dr. de Villa said, the issue we're seeing, it's not hesitancy, rather it's simply access. And it's ensuring and making access to vaccines easy. That's what's having success. So the community outreach, the multilingual outreach, the pop-up clinics, the targeted work with the Black community, with persons living with disabilities, all of that is ensuring and easing access, and that's why we're seeing higher than 65% uptake. Where VaxTO comes in is to ensure that we are able to reach directly every single Torontonian to help provide that access. The principle here, it's just reach everyone wherever they are. And so whether that's phoning you at home, texting you, through social media, engaging you, whether it's in WeChat or Instagram or Facebook, the principle here is access. Make access to vaccines easy and readily available, and that's how we achieve herd immunity.
All right, thank you very much. Thank you for joining us. That concludes today's briefing. Please stay well.